Hello and welcome to Juvenile Arthritis Explained. My name is Corrine Pinter. I'm a mom of a 15-year-old girl, Emily, who was diagnosed at 2 with juvenile polyarticular arthritis, and she today has psoriatic arthritis. Today we have with us, our guest is Dr. Leslie Favier, a pediatric rheumatologist at Children's Mercy Hospital. Dr. Favier is also a clinical assistant professor of pediatrics at the University of Missouri, Kansas City School of Medicine. Thanks for being here.
Thank you so much for having me.
I know for me, trust is a huge factor when it comes to working with doctors, especially your child's doctors, to ensure that they get the best care for sure. And it's not just me trusting them, but also their trust in me that I know what's best for my child. And I know that comes up a lot too. What are some tips for parents to help them strengthen their relationship with physician? For example, can parents best approach tricky subjects like wanting to try complementary therapies or having opinions on certain medications? How can we harness a good relationship with you as a provider to make sure that we're doing what's best for our child, but we're also not neither one's overstepping?
Yeah, and I think that it's nuanced, right? So an optimally functioning doctor-family relationship is going to include mutual respect and open communication. And we should all be operating under the assumption that we have the same goal in mind, that it's about the patient, it's about the child, and making them feel the best that they can, and that they can do whatever they want to do as a child and hopefully not have to worry about arthritis getting in the way. So I always recommend being really open, honest, and clear about what's working and what isn't working. Certainly I don't want to prescribe a plan that's not feasible for a family or that we don't have good faith in. I don't want, if there's any worries or concerns or, things that we haven't fleshed out in terms of why we're doing this, this or that, then I'd like to talk about that in a conversation during an appointment. And, I think we both kind of want to have open trust that our hearts are in the right place. On the flip side, I welcome parents bringing up with me, hey, I've read this, this potential complementary therapy, this diet could be helpful. What do you think about this? Kind of coming at it as this is something that I've read about. Can you tell me what you know about it? And I can tell you what I know about it. And we can see if it's something maybe we can add on. But I think on either side, being evasive or being, aggressive, those aren't going to be met well on either side. So does that make sense? I don't know.
Yeah, and that's not good for the kids either, because as adults too, we have to model a behavior. And if we're going in untrusting, they're going to come in feeling apprehensive as well. And we're all anxious and we're all curious. And at the end of the day, the kid wants to feel better. We want them as parents to feel better. Practitioners want them to feel better. So we really are all on the same page. And it's like you said, it's important to have an open conversation. And I feel like if you bring something of importance to you, attention to the provider, it's okay if you as a provider say to me, I don't really know that much about it, or I don't really know if that's going to work. And if there's nothing that would actually cause any harm or completely negate what kind of treatment plan we're doing, most of the time we get the go ahead to try some things. So it's also just understanding that not everyone knows everything. Not everything's going to work for everyone. It might have worked for your neighbor's cousin's kid, but it might not work for your child. But that's not to say it might not be able to be tried. But again, just being respectful and open, knowing that kind of how we present ourselves as parents to you as providers is also going to dictate how the appointments are going to go as well. So I think we just all need to be, like you said, in the same space of we're here to help our child get to the same space of comfort and care. And hopefully feeling better and being normal.
Yeah, no, I think those are all really, really good points.
Mhm,
And having, like, even when you start your conversations about whether it's like disease prognosis or medication
mhm.
effectiveness, having a reasonable understanding of expectations can be really helpful and clarifying for families too. So, if as a mom you want to know what is, how fast can I expect this medication to take effect? And, what's the percentage of people that are helped by this? Or what can I expect over the next few years, that can kind of color and the expectations you have as a parent, and your child is also hearing that, so they can kind of also understand
Mhm.
what's ahead of me on my road. I know there might be some twists and turns, but kind of how can we work through this together, and if we need to pivot, how are we going to do it,
Right,
um, kind of in a shared decision.
right. And shared decision making is important, and it's good collaborative effort on everyone to make sure we're doing the best for the child at the end of the day. What if we're coming to appointments and we're seeing a practitioner and we're just feeling like maybe this isn't the right fit? Like we've done not just one appointment, because one appointment's not enough. They're usually emotional. Everybody is trying to figure out an answer. But say we've come for 2, 3, 4 appointments and we just feel like, I don't want to do this. Like, how do we navigate that? Because that happens sometimes.
Absolutely. I think that happens a lot in medicine. The
Yeah.
therapeutic relationship, the way you jive, the way you communicate, is really, really important, and it differs practitioner to practitioner. So if you find that there's barriers either in trust, if you feel like you're not quite sure if you're on the right treatment plan, or interpersonally, if you guys are not a right fit, I think those are two different questions, right?
Right.
So if you feel like there's questions that aren't being answered, or you have questions about the plan, but that your trust isn't broken, I think that that's something you can talk with the provider about and say, hey, I just don't understand this part of the care, or I'd like to understand this better. Can you please clarify that? Or I'd like to try this, XYZ approach. What do you think about that? Do you think that's something we can kind of come together and make a plan together? If it's something where maybe it's irrevocably broken, where you do not feel like you're comfortable with that provider, or you're on the wrong track and you'd rather not have a conversation, then there are means of doing that via your clinic. You can reach out to the nursing staff or the office staff, and they will arrange that. Oftentimes, there's kind of a process of getting a second opinion within the same division, or if you'd like a second opinion outside of your hospital system, then going through primary care is the way to do that. But unfortunately, that can happen. This is
Mhm.
a relationship between people, and there are lots of barriers and bumps. Most of the time, it goes smoothly. I think that doesn't happen very often in our division in
Mhm.
general. Most of the rheumatologists are carrying compassionate, detail-oriented people, but things happen, and
Mhm.
we all understand that as parents and providers.
Yeah. And I like how you preface it as a second opinion. I feel like we don't hear that as much anymore. I feel like a lot of times it's just, I want to switch. I don't like this person. I don't like that. I want to cut and dry it. You're really getting a second opinion. You're getting a second encounter with someone different, a different set of eyes, a different um, approach from a professional. We have to look at it too, like, y'all are professionals. We're professional parents. You're professional providers. Um, there should be comfort and respect and trust out of it. So, like you said, it's like any relationship or anything. You just might not jive with the person, and that's okay.
And this is a chronic condition. Most of the time, we are seeing you for years. So if it doesn't feel right on your part, it might not feel right on the provider's part too. So this is bidirectional, I think.
Yeah.